twist ending in trips to the emergency room, or worse, the death of a patient.
ABC15 investigators have spent months looking at how often there are medical complications when a patient gets anesthesia during dental work. Investigator Ann Ryman found dozens of cases and complaints that state regulators are just letting dentists keep their licenses, even after a patient dies in their care.
I missed her cooking, no more holidays together. It hurts. You know, I think about it every day.
Charlene Stemmons was 77 years old, a mother of 5.
She was a beautiful woman, always loved to laugh, smile. Everybody knew her, everybody loved her.
Charlene's daughter, Teresa Rushing, brought her into this dental office in October 2019 to get teeth extracted for dentures.
I hugged her, kissed her, said a prayer with her.
As she sat in the waiting room, Teresa saw an ambulance pull up.
That's how I knew something was wrong.
She coded in the dental chair, was taken to the hospital, and died 10 days later.
Attorney Lincoln Combs represents Teresa, who is suing the dentist, Dr. Ihsan Porsharazi, and the nurse anesthetist, Tori Richmond. Her lawsuit alleges her mother was given a lethal dose of anesthesia.
This procedure should have never gone forward, and it should definitely have never gone forward in a dental office.
An investigation by the Arizona State Dental Board said Charlene's procedure should never have taken place because the dentist lacked the proper permit and did not conduct a pre-anesthesia administration exam. The dentist and the nurse anesthetist both denied liability in court documents. They said they met the duty of care at all times. The dentist said he was unaware he needed an anesthesia permit. This is not an isolated case. The ABC15 investigators submitted multiple public records requests to the State Dental Board. We found 50 cases where dentists called for emergency medical services for a patient under anesthesia. That's just since 2018. But most of the cases, 32, were dismissed by the board. A handful are still pending. At least 7 patients died, including Charlene.
I don't think the public has an awareness of the risks of performing procedures under general anesthesia in a dentist's office.
Of all 50 cases we reviewed, no dentists had their licenses revoked, even when the board found deviations from the standard of care or unprofessional conduct. 6 dentists had some lesser form of discipline. Dr. Porsharazi had his dental license suspended for 6 months and was ordered to take 11 hours of classes. In 3 other cases involving deaths, where the board found dentists violated state statutes, anesthesia permits were suspended for 6 months or a year. 2 other dentists whose patients survived were required to take continuing education.
Sometimes they get a slap on the hand or they get a private reprimand.
Scott Eldridge is a medical malpractice attorney who has handled cases involving deaths after dental anesthesia. He says the State Dental Board, made up mainly of dentists and hygienists, is lax when it comes to discipline.
Public safety is paramount. I understand that when people have obtained these licenses that they want to work, and that's fine. But public safety is more important.
Dr. Anthony Caputo says the dental board does take discipline seriously. He's chair of the board's investigative committee.
What I would like the public to see is the board is doing a good job. And not just a good job, but a better job than previous boards did. This board, I think, functions at a high level.
Dr. Caputo said anesthesia is routinely given at dental offices with no adverse issues.
So the vast majority of procedures done in the dental office are safe. And the data that has been reported on, even though it's minimal, does demonstrate that. The frequency is similar to what happens in medicine. And so that we're certainly not an outlier.
The State Nursing Board also reviewed Charlene's case. It found no unprofessional conduct by the nurse anesthetist. The board did issue a non-disciplinary letter of concern, saying Richmond did not sign the anesthesia consent form. The letter does not mention the death. Dr. Porsharazi still has a dental license in Arizona, but records indicate he currently works in California, where he's also licensed.
I don't think that's someone that should ever have a dental license or be trusted with patient lives and safety ever again.
As for Charlene's family, they want more accountability.
What bothers me the most is that my mom shouldn't be gone. She should be here. That's what bothers me. She should be here right today. She should be here.
Charlon's family continues to pursue the lawsuit they filed in 2021. We reached out to Charlon's dentist and the nurse anesthetist and their attorneys by email and phone. We did not hear back from the dentist or his attorney. An attorney for the nurse anesthetist said they were unaware at the time of Charlon's procedure that she had had a reaction to anesthesia during a prior dental procedure. He called the outcome tragic. I'm investigator Ann Ryman, ABC15 Arizona.
If you have a dental procedure coming up that requires anesthesia, here's some things you can do to make sure it's as safe as possible. Ask your dentist who will give the anesthesia. What are their qualifications? Have they had any adverse occurrences following anesthesia? We have more advice at abc15.com/investigators. And if you have something you want us to investigate, email us at investigators@abc15.com or call that number on your screen.